Use of a novel radiation-free fluoroscopy emulator, iPERC, to improve surgical skills in percutaneous nephrolithotomy. Percutaneous nephrolithotomy has been accepted as the procedure of choice for the treatment of large or complex renal calculi. With the technical advances in endoscopic instrumentation, the number of percutaneous nephrolithotomy procedures has increased dramatically in the last decade, and PCNL has revolutionized the treatment of large renal stones, being a very effective minimally invasive surgery. But this procedure is not a way of having complications, many of them really serious and life-threatening, as excessive blood loss, perforation of visceral structures, among others. This is why PCNL is a surgical procedure demanding a high level of precision and skill, especially when it comes to puncture the selected calyx in the kidney. The learning curve of this procedure most often begins on the patient in the OR, and the vast majority of the urologist feels confident with their skills when they have reached 20 procedures, but the balance in effectivity and security comes at 30 to 60. Almost every PCNL procedure in the world is fluoroscopically guided, and every time the surgeon executes the procedure, he receives about 0.28 millisieverts of radiation despite of the use of protective gloves, glasses, and leaded aprons. The International Commission on Radiological Protection recommends not to have more than 20 millisieverts of accumulated radiation. Currently available PCNL training models using animals and fluoroscopy are costly and have the disadvantage of radiation exposure. We have developed a novel radiation-free fluoroscopy emulator, iPERC, to improve surgical skills in percutaneous nephrolithotomy. This is a simple and portable, low-cost device that can be used with a cellular phone or tablet with video function as screen. This device mimics the CR movements, has an activation pedal for fluoroscopy emulation, and allows the trainee to perforate a structure similar to skin and try to reach the pelvic calyceal system with a needle. The pelvic calyceal system has an electrical circuit and a warning light activated every time the surgeon punctures the posterior inferior calyx in the correct way. Our objective was to evaluate the efficacy of this model in improving PCNL skills among urological surgeons. 14 residents and 16 urologists with no more than 5 previous PCNL procedures and without the use of drugs affecting CNS were enrolled in this prospective study. Participants were instructed to perform 20 puncture attempts at the iPERC model, trying to reach the posterior inferior calyx. The first and last attempt were video recorded, and these videos were evaluated at the end. Evaluated parameters included kidney access time, emulated radiation time, number of CR movements, and number of needle adjustments at 0 and 30 degrees. As you can see in these graphics, once the training was fulfilled, the kidney access time on the left and the emulated radiation time on the right diminished in almost every surgeon, and both turned into a more homogeneous time at the end. You can see the initial times in red and the final times in green. This table depicts how the 5 evaluated parameters improved significantly after the training sessions and shows a separate analysis for residents and urologists. With these findings, we can conclude that the iPERC model constitutes a safe and effective device in PCNL training. This novel tool not only avoids radiation exposure and the use of laboratory animals, but adequately simulates the challenges a surgeon faces while performing this complex procedure.